The Detroit2Nepal Foundation was established in 2010 with the mission to provide sustainable support to grassroots, community-based programs in Detroit neighborhoods and remote villages in Nepal. And these programs have helped to fund several different buildings in Nepal, from schools to libraries to homes to birthing centers, you name it. And this foundation has a local connection right here in West Bloomfield. And joining me right now to tell us more about this program, we have the co-founder of the Detroit2Nepal Foundation, Dr. Richard Keidan, joining us right now on The Splash.
All right, Jake, nice to be here.
Really happy to have you with us. Really interested in getting into this conversation because it's such a cool thing what you're doing in helping all of these people out in Nepal. Can you give us some of the latest construction updates that have been taking place in Nepal recently?
Sure. The most recent work is following the 2023 earthquake that had the epicenter in Jadrakot in western Nepal. And for the first 14 years, we've been working pretty much exclusively in Kotang in eastern Nepal. But because of this very devastating earthquake, we shifted over there. And for the first year, just provided emergency relief, responding to the villages. They would communicate with us what they needed just to survive the winter. They had no homes, no food, no supplies. So it's just a matter of sending them tarps and tents and blankets and food and medicine and any emergency resources. People that were injured were evacuated. Pregnant women were brought down for care. Children that were rendered orphans because of the earthquake were brought down to one of my colleagues who runs Kapila Children's Home for orphans and a very nice school. So we were very busy the first year just with emergency relief, trying to get them through. Now that things have kind of settled down from the acute phase, we've asked them what their priorities are, and they've been schools and homes. So we are working with our ground partner, Build Up Nepal, building earthquake-resistant schools and homes. The communities learn how to use compressed sustainable earth bricks, which is a very eco-friendly way to build with earthquake-resistant technique. The eco bricks are made from either sand and soil or crushed stone, and they're made on-site by the locals. So we train masons to make the bricks on-site. You can see a picture there of they look like Legos. And interestingly enough, about 37% of the air pollution in Nepal is from firing bricks. So just in and by itself, you're preventing a lot of pollution, plus you're using local resources, both the materials as well as the manpower to make these bricks. They're then put together with technology that is earthquake resistant with cement and rebar. It's a time-proven technology. And basically the communities learn how to make the bricks and use this technology while building a community building like the school. And then they form a micro enterprise. They buy the equipment needed, which is about $5,000 or $6,000 for all the supplies they need to partake in this construction. They form their micro enterprise, and then they're responsible for building homes. And again, using the same earthquake resistant technique. And the government is giving each household that was destroyed $3,200 towards this effort, and a two-room home, which is earthquake resistant, costs about $5,600. The other $2,400 is a lot of that is manpower, transport, local supplies. So it's not all just cash. So the locals, for the vast majority, can come up with the extra money. And then instead of building a stone and mud mortar home again, which will collapse and potentially take lives with the next earthquake, you've got an earthquake-resistant home. And with this technique, it's allowing us just to teach them the technology. And once they learn the technology and form the micro-enterprises, they'll be monitoring for this supervision to make sure that everything's being done as up to code and as well as possible.
Wow, that is a lot of incredible things that you were doing over in Nepal, and it's fascinating to hear about the measures that you're taking. You talked about the earthquake-resistant materials that you're using to help build these buildings so that hopefully history does not repeat itself. So that is great to hear of everything that you're doing. But I would imagine that all of this work that you're doing out in Nepal, I'd imagine that it isn't easy. What are some of the biggest challenges that you've dealt with in the work that you've done in Nepal since the 2023 earthquake?
Well, the biggest challenge probably is just the remoteness of these villages. We're not working in urban areas, and just to get to these sites is quite problematic. Now, I've been going to Nepal since 1983, but we started the nonprofit 15 years ago, and just in the last 15 years, a lot of things have changed where there are roads which are basically can accommodate trailers, tractors, and very rugged vehicles, because before, even 15 years ago, everything was taken in by either human or pack animals. So it was very, very complicated. So the remoteness is getting a little easier to tackle, but still getting supplies to these remote areas is quite challenging.
You just touched on something. You said that you've been going to Nepal, I believe you said since the early 80s. And I'm curious, what motivates you personally to continue leading and expanding the D2N Foundation?
Well, I first went to Nepal like most people. They go for the Himalayas to climb. And I was an outdoor guy when I was younger. I still enjoy the outdoors. So I went there purely for selfish reasons. But after a while, as things evolved, I had the opportunities to form a nonprofit, which is really a privilege to work with these individuals. The Nepalese are great people, great families. They're motivated. They're very industrious. You give them opportunities, and they'll take them. Again, we're not doing a lot of the construction. We're doing the education and monitoring. So they're taking all this upon themselves. We're working right now in 20 sites. In all these 20 sites, there'll be micro enterprises forming, and they'll be in charge of the building, again, with supervision. But again, it's on them, and they're very, very capable and very excited to take this work on. We expect just with this initial investment at these 20 sites, we'll have at least 1,250 homes being built. I sent you some pictures of some of those sample homes, and that's for an initial investment this year of $125,000. So if you do the math, that's costing $100 is going to result in having an earthquake-resistant home like you see there, which is going to stand up to the next earthquake and be very resilient and very much appreciated. So you always want to have impact when you're looking for charities and ways to carry out your philanthropic ideas. But this is something where, again, literally $100 will eventuate in having a home like this built for a family. And over the next 6 to 7 years, this is going to spill over to another 40 micro enterprises probably being formed in these same 20 areas, 20 villages. So we'll see, based on prior results after the 2015 earthquake, probably over 4,000 homes being built for a total investment of about $300,000. So that's about $75 resulting in a home, in a safe home. So, this is very, very impactful. We're very excited, and it's a privilege to be able to do things like this.
You should be very excited. For those just joining us right now on The Splash, we have co-founder of the Detroit2Nepal Foundation, Dr. Richard Keidan, joining us right now to talk about the foundation's work overseas in Nepal, building homes and schools and all sorts of other buildings as a result of the 2023 earthquake, helping the community get back to what it was. And you guys are always looking for donations to help the foundation and to help continue to continue everything that you're doing out in Nepal. Tell us a little bit on how people can get involved with this foundation.
Sure. Well, again, as you mentioned, it costs funds, and it's amazing the impact we can with relatively modest funds, but still it costs funds. And people can go to our website, Detroit2Nepal.org, and donate right on the website. Right now, I'm doing a birthday fundraiser for my 70th birthday in 2 weeks. And I'm going to match everyone's donation for the first $10,000, so we can double your impact. And $100 donation will result in 2 homes being built. So, we just need money. We do not need actual, humans to volunteer over in Nepal. we've always had the philosophy that the Nepalese are very capable, and 100% of the work is being carried out by them. So again, we need your dollars. We appreciate your dollars, and the only way we can do this work is with your support.
I'm so glad you just mentioned something. You talked about the event that you're doing throughout your birthday month for your 70th birthday to match the donations of what people are donating. Could you talk a little bit about how that idea came to be?
Well, every year I do a birthday match to try to help, motivate people. And again, what I do is I ask people for money all the time. And, you've got to get skin in the game yourself. I can't ask people for money without putting my own money into this as well. As a rule, I put in 10% personal money for any of our projects. So I'm very much involved. And, when I go to Nepal, I pay for my plane ticket, I pay for my hotels, I pay for transportation over there. So I want people to know that when they give $1 to Detroit2Nepal, it goes to the work, whether the work is in Detroit or in Nepal. And, I want you to know you're getting a bang for your buck, and I'm in it with you.
That's great. I love hearing about that because it shows how much you care about this foundation by setting that example and by putting in that money yourself. And Richard, with all of the work that you do in Nepal and all the times you've been there, could you possibly share a personal story of a student or a family that's positively been impacted by Detroit2Nepal's efforts?
There's so many stories. I can't really think of one individual, but the thing that all the work we do, first of all, is responding to priorities that they identify, not that we identify. And when we started working, just for an example, we started with just going in there. I was on an advisory board for a medical school at the time in the Kathmandu Valley, and I went to this village area with a medical student and a public health expert just to do some assessments of what's up. And we soon learned that all the water taps, even though these were Himalayan springs that where the water was originating from, all these were contaminated with fecal coliforms, which is essentially the from your stool. And so when I went back 3 months later, they said, Dr. Richard, we want toilets. So they were able to identify, without me saying anything, that they wanted to prioritize toilets, realizing that it's one thing when you can treat infections, but if you can prevent infections, it's much more effective. So again, it's not an individual story of one person, but it's really of them collectively. They are intelligent, they understand their needs, they know what they need for themselves and their children more than I could ever understand. And, we follow their direction, and they were able to figure out, it's much more important to start with public health than to actually look for healthcare. So, there's so many stories. But again, I think just to look at them collectively, they're highly motivated, they're intelligent, they're capable of carrying out these projects, whether they're toilets or building medical clinics or schools or earthquake relief. It's just that it's a very poor country and they lack resources. And just with a little bit of help, it's amazing what they're able to do with very modest resources.
A little bit goes a long way. You always love to hear about stories like this. Dr. Keidan, thank you so much for joining with us today on The Splash. One more quick question before I let you go, though. What lessons have you learned personally from your experiences with D2N that might inspire others to get involved with more humanitarian work?
Oh, it's just such an individual thing. I think, probably the biggest lesson I've learned is just how to learn how to listen again. I'm a cancer surgeon, so I spend all day talking to patients, all day giving advice, all day teaching medical students or residents. So I'm a really good talker and probably was not a very good listener. So starting the foundation and working with the foundation, I've had to relearn how to listen so I could listen to learn. So, that's probably the biggest lesson I've learned, just because of my, particular circumstances. But it is so important that we don't be arrogant when we have ideas of philanthropy, and don't think that because we're in a very wealthy country and we've had the luxury of high education and a lot of material wealth and a lot of amazing experiences, we can't be arrogant to think that we know what's best for other people. So again, just to sit and learn, and just to learn to listen again so they can teach us what they need and how to do it. And it's very humbling.
Learn to listen again. A powerful message for everybody to remember. Dr. Keidan, thank you so much for joining us today on The Splash Live, and thank you so much for everything that you do.
My pleasure.